There are many patients that despise the look of their legs, and if you consider the number of legs that I see on a daily basis, you would know that I see a lot of legs, and I can tell you that most people are actually quite hard on themselves because I think most people are quite beautiful and their legs are not that bad. Now, with that being said, some of these patients that hate the look of their legs may have some varicose veins, and once they're treated and the veins have disappeared, they often find these lumpy bits that are around their knee area. They can also be around their thigh or even on their backs, and they're especially concerned with these lumpy bits, thinking that they may be associated with varicose veins. For many of these patients, those lumpy bits are not varicose veins but rather fatty lumps that can sort of accumulate in these areas of their knees, and they can be quite frustrating to look at because it almost feels like you've got big fat knees. Now, that being said, this condition whereby you get this fatty deposition doesn't happen for everyone and is often linked with a condition known as lipoedema, which I've actually spoken about in a previous video, so please have a look at that if you haven't seen that. And in lipoedema, you get this excess accumulation of fat in some areas, and unfortunately, when it's around the knee, it can be quite distressing to some patients because no matter how much you diet or you exercise, this fatty lump doesn't really quite get down. The good news is one way to sort of get rid of it is that you can undergo a procedure known as liposuction, whereby they get rid of these fatty bits or areas with these stubborn areas, and that is a procedure that tends to help. Now, there are some heat energy devices that can help reduce these fatty deposits in some areas, but I can't really talk too much about their efficacy and how much they can reduce it, but I do know with liposuction it does make quite a difference.